Jackson had an absolute, total, and thorough inability to sleep.
I'm here to get justice for Michael Jackson.
Your Honor, I'm an innocent man.
He was not an anesthesiologist. He was not board certified in cardiology. Conrad Murray was not board certified in any medical specialty. Michael Jackson's death was a homicide.
Thank you, Deputy Jones. In the case of People v. Murray, Dr. Murray's present with his counsel as earlier today. The People by their counsel as earlier today. Firefighter Senate, once again, is on the stand, as are all the jurors and the alternates. Good afternoon, everybody. Ladies and gentlemen of the jury, you are the fastest lunch eaters in the history of jury service. I hear your little pitter-pat as you leave to go to lunch, and then I blink, and the next thing I know, you're back. Take a little more time during lunch, please. Enjoy the wonderful cuisine. Firefighter Seneff, good afternoon, sir. Do you acknowledge you are still under oath, still sworn to tell the truth?
Yes, I do.
Resumption of cross, please, Mr. Gorgian.
Your Honor. Good afternoon, Mr. Seneff.
Good afternoon, sir.
We left off talking about CPR, correct?
Yes.
And how it's not unusual for somebody to request for assistance at the time of CPR, correct?
Correct.
Okay. And is it also fair to say that the resuscitation should be conducted where the patient is found?
That would not be correct.
Okay. And you indicated earlier you're familiar with the American Heart Association guidelines, correct?
Correct.
Okay. And isn't it true that the guidelines provide that because of the difficulty in providing effective chest compressions while moving a patient during CPR, resuscitation should be conducted where the patient is found? Would you agree with that?
Yes.
Okay. And previously you testified that when you observed Mr. Jackson, he had an IV tube connected to his leg, correct?
Correct.
Okay. Did he also have a nasal cannula hooked up to his nose?
I did not see a cannula.
Okay. Did you...
C-A-N-N-U-L-A.
You may want to inquire just exactly what that is.
And what is that, Mr. Seneff?
A nasal cannula is a way of providing oxygen to a patient through their nose.
Okay. And did Mr. Jackson have anything else connected to any of his body parts?
I did not see anything else.
Okay. And would that also be a factor to consider whether to move a patient during CPR?
Yes, it would.
Okay. And that's also reflected in the American Heart Association guidelines. Isn't that correct?
I don't know, sir.
Okay. Now, if you're getting adequate and effective chest compressions, okay, and they're being provided at the appropriate depth and rate, it's irrelevant whether the compressions are on a bed or on the floor, correct?
Correct.
The prosecutor, Ms. Brazil, asked you some questions regarding a pulse that was felt only by Dr. Murray. Isn't that correct?
Yes.
You recall that testimony earlier?
Yes, I do.
Okay. And when Dr. Murray indicated that he felt a pulse in the groin area of Mr. Jackson, you didn't think that there was anything suspicious with that, did you?
No, I did not.
Okay, and you didn't think he had any ill motive or any bad purpose of saying that, did you?
No, sir.
Okay. In fact, you previously testified in this case, correct?
Yes.
And when this issue came up, isn't it true that you testified when you do good CPR, it's common to get a femoral pulse from the CPR, correct?
Correct.
Okay. So it's very likely that Dr. Murray did in fact feel that pulse, correct?
Correct.
And that's precisely why you stopped doing the compressions, correct?
Correct.
Because you wanted to check and see whether that was a real pulse or whether it was an artificial pulse due to the compressions, correct?
Yes, sir.
Okay. Now, after the CPR and administering the medications you referred to earlier, UCLA at a certain point tells you to call it, correct?
Correct.
And you weren't comfortable with calling it, were you?
Was I uncomfortable with calling it?
Yes.
I would have preferred to continue, yes.
Okay. And you would have preferred to gone to the hospital because this was a VIP person, correct?
Because it was a VIP, yes, but also because potentially it was a recent arrest.
Okay. And in fact, Dr. Murray wanted to continue it as well, correct?
Correct.
And in fact, that was reflected in the call we heard earlier, correct?
Correct.
where you tell UCLA the doctor here wants to definitely transport, correct? And by that it means let's continue, please, correct?
Yes.
Okay. So Dr. Murray assumes control and full responsibility, correct?
Correct.
Okay. And because of that, he then has to go with you in the ambulance, correct?
Correct.
And that's according to protocol, correct?
Correct.
Okay. When a physician assumes control, he needs to ride in the ambulance with you, correct?
That's correct.
Okay. So after you transport Mr. Jackson to the ambulance, you then head back upstairs, correct?
Correct.
And you went back upstairs so you can pick up the medical equipment that was left behind, correct?
Correct.
And when you got upstairs, you saw Dr. Murray, correct?
Correct.
And Dr. Murray was also picking stuff up, correct?
Correct.
Okay. And he was doing that right in front of you, correct? In plain sight.
Yes.
Okay. He didn't ask you to, oh, Mr. Senna, can you please wait outside for a minute? Correct?
No, correct.
Okay. He didn't ask you to wear blindfolds or to close your eyes in any way, correct?
Correct.
Okay. And you would agree that picking up the equipment that was left behind is the appropriate and the medically reasonable thing to do, correct?
Correct.
Okay, especially in light of the fact that children reside at their residence, correct?
Correct.
And did you see what Dr. Murray was in fact picking up?
I did not.
Okay. Isn't it true he was picking up his wallet and his glasses?
I don't know, sir. The bed was blocking right where his hands were. Line of sight.
Okay, and then Dr. Murray meets you at in the ambulance?
Yes.
Okay, and how much time do you estimate passed between you leaving the room and Dr. Murray joining you?
Moments, minute, 2 minutes.
Okay.
Not long.
Could it have been less than a minute?
Before he joined me in the ambulance?
In the ambulance.
Around a minute. Somewhere around there.
And the prosecutor asked you about a phone call that was placed by Dr. Murray in the ambulance, correct?
Correct.
Okay, do you know who he had called?
No, sir.
Do you remember the substance of the conversation?
No, sir.
And you indicated you arrived at Carrollwood at approximately 12:26, correct?
Correct.
Okay, and you and your team did your absolute best job in trying to bring life back into Mr. Jackson, correct?
Correct.
And would it be fair to say that Dr. Murray also did everything in his power to help Mr. Jackson at that time?
From the time I walked in,
Yes.
to the time I left.
From what you observed.
Hold on.
Yes.
I mean, he wasn't just standing around and talking on the telephone or researching the computer, correct?
No, he was not. That's
Okay.
correct.
And he was trying to help you with whatever he can,
Okay.
Correct.
correct?
Hold on. Yeah. So anyway, I'm gonna sit and eat. I'm eating the food that I had last night from
And
dinner.
at no time while you were there did
Yeah, some
Mr.
spinach
Jackson's
and some-
condition improve in any way, correct?
Spinach
Correct.
and some spinach and garlic and some mushroom and
And
steak.
isn't it true, Mr. Senna, one of the signs of good CPR, effective compressions, is
Mhm.
when the
Mhm.
patient suffers
I'll
fractured
do you like
ribs.
you do me when you be eating.
Would you agree with that?
Mhm.
It's common when you start chest
Mhm.
compressions to hear the cartilage
And I'll call
where
you when I
the sternum
finish.
right here, where the ribs attach to the cartilage.
Okay, there you.
Right there, it's common to hear that crack.
Okay, and in this case, are you aware that Mr. Jackson had sustained fractured ribs?
I was not aware of that.
Okay. Now, the prosecutor also asked you whether Dr. Murray ever mentioned propofol. Do you recall that?
I do.
Okay. Are you familiar with propofol?
Not really, no.
Okay. Do you know that it's got a very short and very rapid clinical effect?
Same your prior answer.
Okay. And earlier you mentioned PEA. Is that pulseless electrical activity?
Yes, sir.
Okay. Can you explain to the jury what that means?
Pulseless electrical activity. On the cardiac monitor, you can normally see a heart rhythm, as we're all familiar with. We've seen it in all the movies, that sort of thing. Pulseless electrical activity is when you have minor electrical activity on the monitor, but no pulses go with it, which is to say that the heart itself is not contracting and making a pulse. But the heart's pacemaker somewhere in the heart may still be firing off electrical activity.
Oh, shit.
And Mr. Jackson in this case was PEA, correct?
It was a combination of asystole and PEA.
Correct. Was it initially asystole and then PEA? Is that kind of what happened?
It floated back and forth between the two.
Okay. And when a patient is PEA, there's certain protocols you need to follow, correct?
Correct.
I mean, there's only so much different treatments you can render when somebody is PEA, correct?
Correct.
For example, and I believe you had testified to this at the preliminary hearing, you wouldn't defibrillate or shock Mr. Jackson, correct, when he's PEA?
Correct.
Okay. And what you do when somebody is PEA is you can give CPR, correct?
Correct.
And you can give the medication that you previously testified to, which was epinephrine and atropine?
Correct.
Was there anything else you could have done?
I'm sorry, the last part?
Was there anything else that you could do for a patient who is PEA?
Sodium bicarbonate, as we gave. Over time, sometimes they'll order calcium. That's about it.
Okay. So isn't it true that you would have done absolutely nothing different because you could not, had Dr. Murray even mentioned the propofol?
Last foundation, cause for speculation.
Stay.
Nothing further, Your Honor. Thank you.
Gorgia, thank you. Ms. Brazil, redirect.
Thank you, Your Honor.
Thank you.
Mr. Senate, Mr. Gorgian, in his questioning to you, characterized the activities of your resuscitation efforts as being sort of confused and chaotic. Do you recall that?
I do.
Was there any confusion or chaos during the performance of the life-saving activities supervised by you and carried out by your team?
No, there was not.
With regard to the tubing near the IV site, you don't know whether tubing was replaced or removed or placed again prior to your arrival, do you?
Prior to my arrival, no, ma'am.
With respect to the femoral pulse that Dr. Murray advised you that he felt, as a result of your verification process by yourself and your colleagues, you're satisfied that the pulse was a result of compression and not an actual pulse in Mr. Jackson's body. Is that accurate?
That is accurate.
Mr. Gorgian asked you about your observations of the defendant when you returned upstairs to retrieve your medical supplies. Would you characterize your impression of the look on Dr. Murray's face when you returned to the room?
He was surprised to see me.
Why do you say that? Was it by the look on his face?
By the look on his face, he turned his head. He was partially bent over. He turned his head sideways to look at me, and just blank look right off the bat. Just surprised. I had the impression he was surprised someone just walked in the room.
Did you characterize that as a deer-in-the-headlight look?
I have characterized it that way.
And you have previously testified to the jury that when you saw Dr. Murray in that location by the nightstand area, by the bed, he also had a trash bag in his hand, correct?
That's correct.
During the more than 40 minutes that you were at Mr. Jackson's side, did you ever see any signs of life in him?
I did not.
Thank you. Nothing further.
Ms. Brazil, thank you. Mr. Gorgia, recross.
Mr. Senate, how long would you say...
I'm sorry, could you just take a moment? Thank you.
He's the first one that has been re-examined twice. Wow.
When would you estimate the time of arrest to be with Mr. Jackson?
That's really hard to speculate on, sir.
Okay. That question was asked of you at the preliminary hearing in this matter, correct?
Correct?
And isn't it true that your testimony was anywhere from 20 to 25 minutes?
I was asked several times. Finally, I committed to at least 20 minutes before we got there.
Okay, and you got there at around 12:26, correct?
Correct.
So if we were to go backwards, that would have been approximately 12:05 would be the time of arrest.
Objection to statement testimony.
Sustained.
12:01 would have been the time of arrest?
I don't know, sir.
Okay. Now, just to clarify, when you went back upstairs, you didn't see what it was that Dr. Murray was putting away, correct?
Correct.
Okay, it could have been his wallet, right?
Call for speculation. Objection.
Sustained due to the earlier testimony.
Okay, but you didn't see, did you?
I did not.
Okay, and again, he didn't ask you to close your eyes or wait outside the door, did he?
He did not.
Nothing further, Your Honor.
Mr. Gorgian, thank you. Ms. Brazil, any redirect?
Yes, briefly, Your Honor. Mr. Seneff, isn't it accurate that at the prior hearing, the preliminary hearing in this matter, you testified that the time of arrest could be anywhere from 20 minutes to an hour? Is that accurate, sir?
That's accurate, yes.
Thank you. Nothing further.
We recross, Mr. Gorgian? Yes, one moment.
Oh, Jesus.
Thank you.
That's all right. You're doing good. You're doing good.
Mr. Seneff, you said when you walked into the room that there was a surprised look on Dr. Murray's face?
Yes, sir.
I'll allow counsel to reopen. Objections overruled. You may answer.
Yes, sir.
Yes? Okay, so he was just surprised, oh, someone walked in, correct?
I don't know what he was surprised about.
Okay, I mean, he didn't stop doing what he was doing, correct?
Correct.
He continued to get his stuff together.
Correct.
Thank you. Nothing further, Your Honor.
Thank you. Anything further?
No, thank you, Your Honor.
Thank you. May firefighter Seneff be excused subject to recall, Ms. Brazil?
Yes, Your Honor.
Mr. Gorgian? Yes, Your Honor. Thank you. Firefighter Seneff, thank you for your testimony in the case. Sir, please don't discuss your testimony or the facts of the case with any other witness until we finish the trial. And while you may step down and leave, you are subject to recall till the end of the case. Thank you, sir.
Thank you, Your Honor.
Ms. Brazil, Mr. Walgan, your next witness is?
Thank you, Your Honor. People call Martin Blunt.
Please. You're welcome.
Who am I at? Okay. This was just too good. Wasn't there? We were. Somebody was getting to. swear, I don't think she's been online lately.
Sir, would you please rise and raise your right hand? Do you solemnly state that the testimony you may give in the cause now pending before this court shall be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Please be seated. Please state your name for the record. Spell your first and last name.
Yes, ma'am. First name is Martin, M-A-R-T-I-N. Last name is Blunt, B-L-O-U-N-T.
Firefighter Blunt, good afternoon, sir.
Hello,
Let
sir.
me provide you with some instructions, which I give to every witness in every case. The first, please sit back and relax. The second, please speak in a loud voice so we can hear you. The third, if you're called upon to provide a yes or no answer, answer that way rather than using slang like And lastly, please wait until you hear an entire question before you even start to respond. Many of us every day think we know what question is going to be asked, so we start to answer it before it's asked in its entirety. In court, just wait for the entire question. Is that all right?
Yes, sir.
Thank you. Correct? Ms. Brisbane.
Thank you, Your Honor. Good afternoon, sir.
Hello, ma'am.
What do you do for a living?
I'm a Los Angeles City firefighter paramedic.
How long have you worked for the fire department?
20 years, ma'am.
Have you been a paramedic the entire time you've been employed by the fire department?
No, ma'am. I became a paramedic in 1999.
Describe for me, please, your paramedic training. What did it consist of?
The paramedic training was altogether was for a year. Once we got there, we did 6 months of didactics, and then we went into clinical field, and went on to the field for 4 months of on-job training.
Who taught those classes?
UCLA paramedic instructors.
Doctors and nurses?
Yes, ma'am.
And your experience in the field also supervised by more experienced paramedics?
Yes, ma'am.
Is there a recertification process that you undertake to maintain your paramedic certification?
Yes, ma'am. It's called continuing education, and it's every 48 months after you do your license.
I'm sorry, I wasn't able to hear what
I'm
you
sorry,
said.
I'm sorry. It's called continuing education, and it's every 48. It's for 48 hours for every 2 years.
So every 2 years, you're required to take 40 hours
48 hours. I'm sorry.
48 hours?
Yes, ma'am.
Moving to June 25th, 2009, sir, where were you assigned in your employment with Los Angeles Fire Department?
Fire Station 71. The address is 107 South Beverly Glen Boulevard, in the corner of Sunset and Beverly Glen.
Did you respond to a radio call coming into your station at approximately 12:21, directing you to an address 100 North Carrollwood Drive?
Yes, ma'am.
Is that basically just down the street from your Fire Station 71?
Yes, ma'am.
Did you ride in a fire truck or a rescue ambulance to the location?
Rescue ambulance, ma'am.
Were you the driver or the passenger?
Driver.
Who was the passenger?
Firefighter paramedic Richard Smith.
When you arrived at the Carrollwood location, you parked your vehicle
Yes, ma'am.
in front of the residence,
Yes, ma'am.
inside the gates,
Yes, ma'am.
near the front door.
Yes, ma'am.
After you parked the rescue ambulance, did you go inside the residence?
Yes, ma'am.
Were you assisted by individuals directing you to the proper location inside the residence?
Yes, ma'am.
Who were those individuals, if you know?
It was bodyguards on the staff.
On the staff?
On site, yeah, on site.
Besides yourself and your partner, Rich Senef, were there other rescue personnel who responded to Carrollwood?
Yes, ma'am.
Who were those individuals?
First was our captain, was named Captain Jeff Mills, firefighter Brett Herring, and firefighter paramedic Mark Goodwin.
Did those individuals arrive on a fire truck?
Yes, ma'am.
Fire truck parked outside the residence on the street?
Yes, ma'am.
Did you enter the residence and proceed upstairs to the location where you were informed a patient needed assistance?
Yes, ma'am.
Were there other individuals in your paramedic group who entered the bedroom before you?
Yes, ma'am.
When you entered the bedroom, what did you see?
I saw a gentleman laying on the bed when I got upstairs.
Was the patient fully on the bed or partially on the bed?
He was fully on the bed, ma'am.
And did you see someone that you see in the courtroom in the residence
Fully on the
bedroom as
bed?
well as the patient?
Yes, ma'am.
Is that individual seated here, Dr. Conrad Murray, in the dark suit and the white shirt,
Yes, ma'am.
indicating, thank you, Your Honor, indicating the defendant?
Yes.
Once you step inside the bedroom, tell me what you see going on by those who've entered before you.
Two of our individuals, it was Mark Goodwin and Brett Herring, was assisting Dr. Murray, helping the individual off the bed onto the floor.
Did you see anyone other than Dr. Murray, aside from your group of rescue personnel, inside the bedroom at the time that you entered?
No, ma'am.
Describe, please, your observations of Dr. Murray when you entered the bedroom.
He was a little flustered, ma'am. He was sweating profusely, and he was a little agitated.
Did you hear him say anything when you entered the room?
Yes, ma'am.
What was that?
He'd say, he needs help. Could you help him, please?
As the driver of the rescue ambulance, do you have a particular role pre-assigned that you will be performing when you attend to the emergency once you've arrived?
Yes, ma'am.
What was your designated role when you arrived to Carrollwood?
I was the driver, and I was considered the patient person, and my job is to initial treatment and assessment of the patient.
So you're directly hands-on with the patient, correct?
Yes, ma'am.
And your partner, Richard Senef, he was the passenger. Did he have a different role?
Yes, ma'am.
Was he the communications person? Obtain information, convey information to rescue personnel located off-site?
Yes, ma'am.
When you entered into the room, strike that. When you entered the room and you saw the patient, did you recognize who the patient was?
Yes, ma'am.
Did you immediately recognize him?
Yes, ma'am.
And you recognized him to be Mr. Michael Jackson, correct?
Yes, ma'am.
Once you are inside the room, you've made the recognition that the patient is Michael Jackson in distress. Do you see your colleagues relocating Mr. Jackson to an area at the foot of the bed?
Yes, ma'am.
Once Mr. Jackson is located at the foot of the bed, do you begin particular efforts as part of your designated job to assist him?
Yes, ma'am.
Describe what you did, please.
Yes, once we all arrived on scene, we got there. First thing I did was I had my medical box and my defibrillator in my hand. I went up to the head of the patient and opened it up and start basic life support, which was CPR on the patient. What we did was one of the individuals started doing compressions, and I started giving breaths for the patient. I pulled out my BVM, which is Ambu bag, and I started to breathing for my patient at that time.
Let me stop you there for a second. Let's just focus on your basic life support efforts. And if I understand your testimony correctly, your job is to provide air to Mr. Jackson, correct? Independent of chest compressions and CPR, just focusing on airway. Would you characterize that as being the most important life-saving function that should start immediately, and you did start it immediately?
Yes, ma'am.
And you used the phrase basic life support, correct?
Yes, ma'am.
Now, I want to focus just on the steps that are encompassed within your characterization of basic life support. Prior to the time that you introduced the AMBU bag into your efforts, did you use a tongue suppressor to assist you in any way?
Yes, ma'am.
Describe what you did, please, and what the function was of the tongue suppressor.
Okay. It's what we call it oropharyngeal. It's called OP airway. And what
Spell the word you used, please.
It's oropharyngeal. That's what it's called, airway. And what it does is that's like a tongue suppressor. And what it does is that you stick insert into the mouth to depress the tongue, so the tongue would not go in the back of the mouth to stop the air from going in.
Mr. Blunt, would that be similar to when you're a child and you go to the doctor and a tongue suppressor is placed on your mouth so the doctor can look down your throat, only a more sophisticated version?
Yes, ma'am.
So the tongue suppressor is utilized by you to hold the tongue down to make your job easier with the airway assistance?
Yes, ma'am.
So once you put the tongue suppressor in the mouth, what's the next step that you take in your basic life support endeavor?
Head tilt, chin left. I took the head and tilted back a little bit, so that way it'd be a clear view, a clear focus into the lungs, so it would be no obstructions.
So you take Mr. Jackson's head and you tilt it slightly and in a way to make the airway be as clear and unobstructed as possible so that if he's breathing, he can breathe, correct?
Yes, ma'am.
Do you then utilize the AMBU bag to further assist in this basic life support for breath?
Yes, ma'am.
Describe how that works, please.
It's like artificial air. Normally people come down and give you breaths, but all it does is that it's like a big ball. And what it does is that it has a mask on it, and you cover the nose and the mouth with it, and you blow into it, and it's just like blowing into a person's mouth with your mouth itself. And when you depress it, it automatically inflates itself again.
It's a more efficient method than mouth-to-mouth resuscitation where one person's mouth on the victim's mouth?
Yes, ma'am.
Do you utilize an oxygen tank in any way with the AMBU bag apparatus?
Yes, ma'am.
And did you in fact utilize an oxygen tank when you affixed the AMBU bag and the suction mask to Mr. Jackson's face?
Yes, ma'am.
Was that an oxygen tank that you brought with you?
Yes, ma'am.
Did you complete all of these basic life support steps by yourself?
Yes, ma'am.
And approximately how much time in minutes or seconds would you estimate that it took for you to accomplish these very basic steps that you just described for us?
A minute or so, ma'am.
And to accomplish that, you used a tongue suppressor, an AMBU bag, and the oxygen source, the oxygen tank, correct?
Yes, ma'am.
After you completed the basic life support, did you then progress to another form of breath support for Mr. Jackson?
Yes, ma'am.
Describe what that entails, please.
Yes. It's called advanced life support. And at the time, I took an endotracheal tube, which it's a device that we put down the throat into and attach it on to the trachea. So 100% air is going directly into the lungs.
Is this a more superior source of breath or air for Mr. Jackson than the AMBU bag?
Yes, ma'am.
Did you accomplish this advanced life support action on your own without any assistance from others?
Yes, ma'am.
And did you connect Mr. Jackson's endotracheal device to the oxygen tank that you brought with you as well?
Yes, ma'am.
Approximate for me how much time this advanced life support steps took you in total?
45 seconds.
Mr. Blunt, in your opinion, is intubation a basic or an advanced paramedic skill?
Advanced, ma'am.
Is it one that a paramedic learns early on in his or her career?
Yes, ma'am.
Mr. Blunt, what are your observations of Mr. Jackson's physical condition as you can see and assess him at the time that, during the roughly 90 seconds where you have conducted these life-saving efforts that you've described for us?
He was non-breathing, he was non-moving, and his eyes were fixed and dilated.
Were his eyes open?
Yes, ma'am.
So fixed and dilated basically means that they were staring straight ahead, seemingly unseen?
Yes, ma'am.
Mr. Blunt, in your 11 years at that point of time experience in emergency situations and arrest situations, did you have an opinion as to whether or not Mr. Jackson was alive at the time that you were making this assessment that you've just described for us?
Felt he was dead, ma'am.
As you were conducting your life-saving efforts and making your observations, was there other activity going on in the room by other individuals? For example, CPR and attempts by paramedic Sinnott to obtain information regarding the patient's condition?
Yes, ma'am.
Did you observe any medical equipment inside the bedroom area near where you were located or where your field of vision was?
Yes, ma'am.
Describe what you observed, please.
Observed oxygen tank.
Anything else?
Yes, a long tube with a nasal cannula attached to it.
Describe what a nasal cannula is, please, sir.
Yes, ma'am. It's a form of giving a person oxygen. What it is that it's two tubes, small, circular shape that goes inserted to the nose, and the tube itself go around the ears underneath the chin.
May the record reflect the witness indicated when he said goes into the nose, his left and right nostril. When he indicated over the ears, he indicated that it went over his ears and around the back of his head. Is that correct, sir?
Well, in the front, ma'am, and it locks underneath his chin.
So the strap, if you will, goes around the ears of the patient and then in towards the front under the chin, correct?
Yes, ma'am.
And you noticed that nasal cannula on Mr. Jackson's face?
Yes, ma'am.
Did you notice any other medical equipment around or attached to Mr. Jackson's body?
Yes, ma'am.
Describe what you saw, please.
Had an IV attached to his right leg, and had a IV, I think it was a 1,000 cc bag attached to an IV stand.
Did you notice an EKG or an ECG machine anywhere in the bedroom?
No, ma'am.
Did you notice a capnography machine or device anywhere in the bedroom or near Mr. Jackson's body?
No, ma'am.
Did you notice a pulse oximeter anywhere near Mr. Jackson's body or on his body?
No, ma'am.
While you were conducting your tasks related to assisting Mr. Jackson, were you able to see the heart monitor that paramedic Sinnott had hooked up and was observing?
Yes, ma'am.
At any time when you are assisting Mr. Jackson, did you see any activity or rhythm on the heart monitor?
No, ma'am.
Would it be accurate that your observation of the heart monitor be that the heart monitor indicated an asystole condition or flatline condition?
Yes, ma'am.
Mr. Sinnott's role was to obtain vital and important information regarding the patient's condition, any medications, or anything that might assist the paramedics in saving Mr. Jackson's life, correct?
Yes, ma'am.
Did you hear Mr. Sinnott ask Dr. Murray specifically for information related to Michael Jackson's medical condition or care or medications?
Yes, ma'am.
Did you hear Mr. Sinnott ask Conrad Murray whether or not Mr. Jackson was taking any medications?
Yes, ma'am.
What did you hear Dr. Murray respond?
No.
Did you hear Mr. Seneff ask about any pre-existing medical condition that Mr. Jackson may have?
Yes, ma'am.
And what did you hear, if anything, Dr. Conrad Murray reply to that question?
He replied no.
Did you hear Conrad Murray tell Mr. Seneff that the patient was a healthy 50-year-old male?
Yes, ma'am.
Did you hear Dr. Murray provide information as to what treatment he was providing to Michael Jackson?
Yes, ma'am.
What did you hear Conrad Murray say?
Normal saline.
Did you hear Conrad Murray elaborate as to why he was providing normal saline to Mr. Jackson?
Yes, ma'am.
What did you hear Dr. Murray say?
He stated that Michael Jackson was rehearsing for 16 hours. He came home, he was very exhausted, and he was dehydrated, and he wanted to get rehydrated.
Did you hear Mr. Seneff ask Conrad Murray whether or not Mr. Jackson was taking any recreational drugs?
Yes, ma'am.
What did you hear Conrad Murray reply to that question?
He said no.
During the attempts to assist Mr. Jackson, were there starter drugs administered to him?
Yes, ma'am.
Was one of the attempts at the administration of starter drugs performed by paramedic Goodwin? Can I have a moment, please?
Please.
Sure. Counsel?
Brazell, thank you.
I'll wait till defense counsel regroups. May I proceed, Your Honor?
You may.
Thank you. As I was saying, did part of the efforts to assist Mr. Jackson include administration of starter drugs, atropine and epi?
Ms. Brazell, thank you.
I'll wait till defense counsel regroups. May I proceed, Your Honor?
You may.
Thank you. As I was saying, did part of the efforts to assist Mr. Jackson include administration of starter drugs, atropine and epi?
Yes, ma'am.
Was one of the efforts to administer those drugs by locating a vein in Mr. Jackson's right and left arms?
Yes, ma'am.
Did you see which rescue personnel was attempting to locate a vein in his arms?
Yes, ma'am.
Who was that?
Paramedic Mark Goodwin.
Did you see paramedic Goodwin make multiple attempts to locate a vein in order to administer starter drugs?
Yes, ma'am.
Was he successful or unsuccessful?
Unsuccessful.
Did you see paramedic Seneff then locate a jugular vein, one in the neck, in order to administer another round of starter drugs to Michael Jackson?
Yes, ma'am.
Sir, I'd like to show you an exhibit previously marked as People's Number 22. May I have the lights, please, Your Honor?
Mr. Sayre, thank you.
call center from wireless line.
Sure. Certainly. We have an alarm. There are usually times of the day and days of the week when we have the alarms go off. It's probably going to take a moment. Right now, there's no cause for concern. Deputy Jones has got all sorts of responsibilities. We'll just check to see if this is a regular alarm or not. And it's distracting, so give us a moment, please. I will be the first one out of here, ladies and gentlemen, if it's anything more than that. So please don't be concerned right now. And if you want to, excuse me for a moment, ladies. Just give us a moment.
Okay, seem like there's some issues going on. So right now we currently have Martin Blake. I think that's his name, Martin something.
Ladies and gentlemen, it was an accidental pull by a child on another floor. So everything's fine, please. And we're not going to hopefully be distracted for another short period. Ms. Brazil. Deputy Jones, thank you.
Please take a look at People's Number 22. It's on the projection screen. Does this photo permit you to show us where you were located when you were rendering aid to Mr. Jackson?
Yes, ma'am.
There's a pointer to your right. If you'll use that laser pointer to show the jury where you were located, please.
Here, ma'am.
May the record reflect the witnesses indicating the area on the carpet at the foot of the bed near the area that has been designated as the far side of the bed in front of the red chair located on the left.
Yes.
Mr. Blunt, at some point during the resuscitation effort for Mr. Jackson, you were located in that area in front of that second red chair, the red chair to the left?
Yes, ma'am.
Did you see anything unusual on the floor when you were in that area assisting Mr. Jackson?
Yes, ma'am.
Describe what you saw, please.
I saw 3 open vials of lidocaine.
Where were those 3 opened bottles of lidocaine located?
On the floor, ma'am.
Could you show us?
Yes, ma'am.
May the record...
2 in this area here and 1 far over by the oxygen tank, ma'am.
May the record reflect the witness has first indicated 2 here, and that would be closest to the corner of the bed. Let me ask a follow-up. Mr. Blunt, were those 2 bottles of open lidocaine that you indicated on the carpet area area or the wooden floor area?
Wooden floor area.
And the third bottle of lidocaine that you described that you observed as closer to the oxygen tank, would that vial be on the wooden portion of the floor or the carpet?
On the carpet, ma'am.
What is lidocaine?
It's an antiarrhythmic drug. It's a heart drug, ma'am.
Did the paramedics administer any lidocaine to Mr. Jackson during the resuscitative efforts?
No, ma'am.
Do paramedics even carry lidocaine with their resuscitative medications?
No, ma'am.
And you told us that you heard Dr. Murray being questioned by paramedic Seneff in his effort to obtain information. Did you ever hear paramedic Seneff, did you ever hear Conrad Murray state that he had given Michael Jackson any lidocaine?
No, ma'am.
Did you ever hear Dr. Murray state that he had given Mr. Jackson propofol?
No, ma'am.
Did you hear Dr. Murray provide information regarding any medications that he had given Mr. Jackson?
No, ma'am.
At some point during your resuscitative efforts, did someone indicate they felt a pulse on Mr. Jackson?
No, ma'am.
Did you ever hear Conrad Murray indicate that he felt a pulse?
No, ma'am.
Do you recall testifying in the preliminary hearing that you heard Conrad Murray say he felt a pulse in the femoral region, and at that point you made an observation of a medical device located on Mr. Jackson's body?
Yes, ma'am.
Does that refresh your recollection?
Yes, ma'am.
What did you hear Conrad Murray say in relation to feeling a pulse?
He was down in the groin area of Michael Jackson, and he said he felt a pulse.
At the time that Dr. Murray stated that he felt a pulse in Mr. Jackson's groin region, what medical activities were taking place?
I'm sorry?
What resuscitative efforts were taking place? For example, were chest compressions being conducted on Mr. Jackson at the time that the defendant stated he felt a femoral pulse?
Yes, ma'am.
And in response to Dr. Murray indicating he felt a pulse, did compressions stop for a moment?
Yes, ma'am.
Why would that be important to do?
It's important to see if the patient has a pulse on his own, or are we giving him an artificial pulse, ma'am?
Compressions can create blood flow through the body and thereby create an artificial pulse?
Yes, ma'am.
Once compressions stopped, did others check for verification to see if they felt a pulse?
Yes. Yes, ma'am.
Was there any indication that anyone else felt a pulse?
No.
May I just have a moment, Your Honor?
Sure.
Mr. Blunt, at the time that the resuscitation efforts were being carried out, was a paramedic Seneff speaking to UCLA Base Station and communicating information concerning Mr. Jackson's condition?
Yes, ma'am.
At approximately 12:57 p.m., did you hear UCLA Base Station advise your team that further efforts would be futile and that they were prepared to call time of death?
Yes, ma'am.
Did you have any reason to believe at that point in time that Mr. Jackson was alive?
No, ma'am.
At any time when you were in Mr. Jackson's presence, did you see any signs of life?
No, ma'am.
After UCLA indicated that they were prepared to call time of death, Dr. Murray requested to assume control of the patient. Is that accurate?
Yes, ma'am.
And shortly thereafter was Mr. Jackson prepared for transport from the Carrollwood residence to UCLA Hospital?
Yes, ma'am.
To facilitate that transport, was Mr. Jackson placed on a backboard?
Yes, ma'am.
At the time that he was placed on the backboard, was he then taken downstairs?
Yes, ma'am.
Did all the paramedics take him downstairs?
Yes, we did.
Prior to Mr. Jackson being transported downstairs, did you see Dr. Murray do anything with those lidocaine bottles that you had previously testified to us you saw on the floor near the bed in Exhibit 22?
Yes, ma'am.
Tell me what you saw Dr. Murray do with those lidocaine bottles, please.
He scooped all 3 of them up and put them into a black bag.
Where was that black bag located when Dr. Murray placed those lidocaine bottles inside?
I'm not sure. It just showed up. I don't know where he got it from.
Where was Conrad Murray located when you saw him scoop up those lidocaine bottles and put them in a black bag? Are you able to show us
I can show
on
you.
Exhibit number 22?
After he got Mr. Jackson all loaded up to go, Mr. Murray was off in this area here.
I'm sorry, Your Honor, may I request the lights be dimmed, please?
Please?
Thank you. Mr. Blunt, will you proceed with your explanation again, please?
Once we got Mr. Jackson loaded up to take him to the hospital, Mr. Murray was off in this area here.
May the record reflect the witnesses indicating the wood floor area on what's been designated as the far side of the bed, in between the TV located on the floor and the red chair that's to the left.
Sorry, is that a fair statement? Yes, ma'am. Yes, sir. Sorry. All right. Thank you.
Did you ever see those lidocaine bottles again?
No, ma'am.
And, of course, you were preparing and the others were preparing to take Mr. Jackson down the stairs so he could be transported to the hospital, correct?
Yes, ma'am.
During transport to UCLA, did you ride in the rescue ambulance with Mr. Jackson?
Yes, I did.
Where were you situated relative to Mr. Jackson's location?
Towards the head.
Were there further resuscitative efforts, including any additional starter drugs administered to Mr. Jackson during transport from Carrollwood to UCLA?
Yes, ma'am.
Was there any change in your observation, either by viewing a monitor or your own observations of Mr. Jackson's physical condition during the time of transport to UCLA?
No, ma'am.
Inside the rescue ambulance, did you see Dr. Murray engage in any activity that did not appear to have anything to do with medical treatment to Michael Jackson?
Yes, ma'am.
What did you see Dr. Murray do?
He was on the phone, ma'am.
Could you see him speaking on the phone?
Yes, ma'am.
Could you hear what he was saying?
Briefly, yes.
What did you hear him say?
He said it's about Michael, and it doesn't look good.
You don't know to whom he was speaking, do you?
No, ma'am.
May I have a moment?
Okay.
A few more questions. Mr. Blunt, you indicated that you saw Dr. Murray touching the groin area of Mr. Jackson when he indicated he felt a femoral pulse, correct?
Yes, ma'am.
And did you see anything on Mr. Jackson's body at that point in time?
Yes, ma'am.
Describe what you saw, please.
Mr. Jackson had on a condom catheter, ma'am.
Describe for us, please, what a condom catheter is and what its purpose is.
Yes, ma'am. It's like a condom with a long tube on it.
And its purpose?
When the patient urinates, it's collected into a bag.
Is it typically used when someone isn't capable of getting up to go to the bathroom on their own?
Yes, ma'am.
And in terms of the statements that you heard in response to paramedic Sinif's questioning, did you hear paramedic Sinif ask Dr. Conrad Murray how long the patient had been down when you arrived?
Yes, ma'am.
What did you hear Conrad Murray respond to that question?
He said he's been down for about 1 minute.
Your observations and assessments of Mr. Jackson when you were providing basic life support and advanced life support, creating breath and airway for him, did you also observe the relative temperature of his skin?
Yes, ma'am.
Describe what it was, please.
It was warm because he was in the bed, so it was warm.
When he was on the floor and you were providing care to him, was his skin cool to the touch?
Yes, it was cool, yes.
And you described for us the other observations you made regarding his eyes being fixed and dilated and no heart activity once he was hooked up to the monitor immediately after your arrival. Did those observations of his physical condition and his heart monitor activity comport with your hearing the information that Mr. Jackson had only been down for 1 minute prior to your arrival?
Yes.
That made sense to you?
No, it did not.
How was it contradictory to your view?
With his condition and where he was, like he'd been down a little longer than 1 minute.
So the information that he'd been down for 1 minute, in your view and your assessment and your medical experience, was incorrect. Is that accurate?
Yes, ma'am.
Thank you. I have nothing further.
Thank you. Ladies and gentlemen, we are going to take a break a little early. I know you're looking at the clock, but we have some matters to discuss. It's not going to take all that long, so we're going to take a minute after the break. It'll be at least 15 minutes, maybe about 20. Please remember all the admonitions and instructions, both in writing and verbally, and please take your break in the jury room. We'll be back with you in about 15 or 20 minutes.